Hello, and welcome to a presentation on the navigation component of Ready for School, Ready for Life. I'm Christina Dobson with Ready Ready, and today I'm going to share a bit about the goals and structure of the navigation system that has been designed for the prenatal to age 3 period. And then I'll offer some considerations for the planning process to extend navigation to age 5. First, navigation is one of the priorities of Ready Ready. Others you may be familiar with include building enabling technology, driving continuous quality improvement, expanding proven programs, and more. All of these together are informed by a commitment to family engagement and equity and inclusion. Collectively, through all of these strategies, we aim to move the needle on outcomes at the population level in Guilford County across this continuum. We know that to achieve this goal, we must address the persistent disparities in outcomes experienced by local families. So you may be asking yourself, what is navigation? Well, before we get into the what, let's take a moment for the why. When Ready Ready was launched back in 2015, they started by talking to hundreds of Guilford County families and providers. The stories they heard were consistent and heartbreaking, but may not be surprising to you. Families in Guilford County struggled to connect to services that could help them be safe, secure, and fulfilled, and raise healthy and thriving children. We heard that there was no systematic way to connect families with services. Often families lacked information about what healthy development looks like, as well as services that could address issues. Frequently, they reported barriers to accessing services such as transportation, limited hours, wait lists, or lack of interpreter services. And sometimes they mentioned being labeled or stigmatized for their insurance status or zip code or other factors. In short, children were growing up in the gaps between services they may have benefited from. To address this, partners across the county have worked to design a navigation infrastructure that connects with all Guilford County families to assess for and address a wide range of needs during the prenatal to early childhood years. We start with the idea that all families can benefit from information and support during these times of transition. Families connect with their navigator at their prenatal or pediatric provider, or if they choose, through other community programs already serving them. At annual touchpoints, navigators will assess for child and family strength and needs, offer brief guidance on age-appropriate topics, and connect families to information, programs, or resources that can benefit them. This infrastructure of universal assessment, targeted connection, and ongoing support between touchpoints will proactively identify challenges before they impact a child's development, enable families to seamlessly connect to appropriate services and any support necessary to reach their goals, and ensure that children do not fall through the cracks as new needs emerge. It will also support programs in connecting seamlessly with their service populations. It is important to note that navigators are not case managers. For families who need longer-term, more intensive support, navigators work to connect them to programs that provide those services. The tools and processes for prenatal to age 3 navigation have been designed by a set of work groups overseen by the Navigation Steering Committee. These work groups designed a process intended to maximize opportunities to connect with families and encourage open sharing of family strengths and needs. Understanding that navigation has a universal mandate and that families have diverse expectations and preferences, work groups embedded multiple opportunities for disclosure of needs or concerns through varied methods. This layered approach includes a paper or electronic screening process, followed by a guided interaction with a navigator that revisits areas of particular sensitivity through a guided responsive conversation. The conversation leads to an individualized response whereby the navigator uses clinical judgment and training, soliciting the family's wishes to determine what services and resources may be beneficial to the health, development, and well-being of the child and family. Navigators follow up with families after 4 weeks to ensure referrals have become connections, troubleshoot any barriers, reinforce messaging, and to assess satisfaction. The process begins again when the family comes in for their next annual appointment. One goal of navigation is to streamline system navigation for families. Where possible, we want to capitalize on relationships that already exist with providers who can deliver navigation. The Navigation Steering Committee is populated by programs that are partnering in not only the design, but also the delivery of navigation. Family Connects, Healthy Steps, and Nurse Family Partnership have committed to integrating their models in service of the collective navigation system. While core navigators are employed through Children's Home Society, Nurse Family Partnership, Family Connects, and Healthy Steps are considered program-based navigators. These models have agreed to share in the delivery of the 5 navigation touchpoints over time, ensuring that relationships with families are not disrupted or duplicated, and all families can receive the navigation service in a manner that is convenient, accessible, and delivered by a trusted provider. While plans for integration have been made, we are just beginning the process of operationalizing these integrations. As we look toward generating a plan for navigation beyond age 3, we thought it might be helpful to highlight a few of the core elements of prenatal to 3 navigation. First, the universal approach allows navigators to connect with all families to ensure no families fall through the cracks. Just as important is the fact that this approach reduces any stigma a family may perceive as to why they are being asked about their circumstances. The targeted connection aspect of this work ensures that families with more complex needs are identified and connected to services that can help. The family-centered aspect of this work brings providers out of silos to work collectively to build a responsive system of care for children and families. This process asks what will work best for families and designs with that in mind. And this phase of navigation has capitalized on the relationships families have to their medical providers as a context where families can be engaged. It is important to note that there is a work stream on how we find and connect with families who do not access care at medical homes. So the task of the age 3 to 5 design team is really to develop a high-level plan for the next phase of navigation. This group is tasked with developing recommendations for ages 3 to 5. The Navigation Steering Committee will review these recommendations and bring them to the Get Ready Guilford Executive Committee. The recommendations should include which partners should or could be engaged for design and implementation of navigation at these ages, where can we or should we connect with families to ensure the broadest reach across Guilford County, and what is the ideal timing of navigation touchpoints to meet the needs of families and understand how best to connect them to resources that can improve their outcomes. The Navigation Steering Committee met and provided some guidance for this group on what you might consider as you begin to develop these recommendations. The steering committee felt that it was important to remember that families should have a seamless experience across providers. Providers need to come with the consideration of adjusting their approaches to provide that more seamless experience for families. There also may be an opportunity to bridge the gap between the medical system and the education system. The steering committee feels that it's critically important to include the perspective and ideas of families and wondered how the Ready Ready Parent Leader Network would be involved in this work. Steering committee also felt that it was important to consider the role of early care and education in all manners that care is delivered in licensed settings and unlicensed settings, as well as through pre-K programs. And the Navigation Steering Committee wondered whether navigation at age 5 might be conducted in collaboration with the school system and really considering the timing of kindergarten entry in that question. We hope this information about navigation is helpful to you as you embark on this important work. And the Navigation Steering Committee and Ready Ready staff are always available to provide more information or answer questions.